Thank you, everybody who have joined the call already. And to all of those who have actually joined on time, let's begin the session. As and when people keep joining, they will be able to participate with us as well. I would request all the participants to switch off their videos, please, so that only the speakers and the panelists are on video and we can, have a better bandwidth. So thank you everybody again. Welcome to this webinar, which we are calling the Empathy in Action webinar. And we are hosting it in collaboration with SMX Network, who are our partners in organizing this. And today we are joined by extremely esteemed and senior CSR professionals, the diversity and inclusivity leaders, as well as healthcare experts under one virtual roof, so that we can delve into the crucial role that corporate citizens play in transforming our society, and particularly in terms of advocating for the rights and welfare of intersex children, which is the cause that we advocate for and support at Intersex Children's Foundation of India. So let's start this discussion, and hopefully we will be getting a lot of ideas, a lot of inspirations, a lot of encouragement and insights from everybody who's present here. If any of you during the session has a question, I would request you to please type it in the chat box, and we will pick it up during the panel discussion, or we will pick it up post the panel discussion. And kindly keep yourself on mute so that there's least amount of disturbance. So to begin, our keynote speech for today will be given by Dr. Sanjay Rao. He is not only an extremely senior healthcare expert, but he's also an extremely visionary person in the field of pediatric surgery. He has worked extensively with intersex children and their parents. And today he will be setting the context for us for our continuing discussion in the panel. So I would hand over the floor to you, Dr. Rao, and over to you. You're on mute, Dr. Rao.
Yeah, thank you very much, Kaushmi, for having me over for this. And I think at the outset, I must sort of congratulate you and for taking this movement forward. These are areas that are extremely difficult, extremely challenging, and it's good that somebody has decided to focus on it and is pushing through. And as I've seen over the months, I think you're going about it in a very systematic manner. So what I intend to do today is basically, as you said, set the tone. I'm starting with the premise that this is an area that is not entirely very familiar to many people. So I will try to keep it in a way that I understand it and it is easy to communicate. And if there are any specific questions, I will be more than happy to take them at any point during this presentation. So let me just share my screen. Please confirm that you're able to see it.
Yes, Dr. Rao, we can see it. Others, can you all see it as well?
Yes.
Yes. Great.
Okay. Yes. So I think, as I said, this is a difficult area in the sense that this is something that is not out in the open. This is something that people who suffer do not wish to publicize. There is a lot of half-cooked knowledge, a lot of half-cooked ideas that are circulating about, but these are important because as time has progressed and we have also seen in the media and in general conversation and in general discourse, a lot has been talked about of late of sexual orientation, of LGBTQ, intersex, etc., etc. So I will just try to clarify various things here, and then, as I said, I'm more than happy to take it forward. Does society have a role? Is the question that I'm asking. And here, I think, as representatives of the society, I think the main panelists who are members from various CSR organizations, etc., you, I think, represent society for us in the context of this meeting. So do we have a role in looking after these patients, or is it just a medical problem that we as doctors need to sort out? At the outset, I think I need to warn people that there is a lot of terminology, and a lot of this terminology is not standardized. So different people use different terms, but they actually mean different things to different people. You know? And this terminology continues to evolve. Even today, this is in a flux. We still do not have very clear terminologies and definitions of what is going on. Nevertheless, there is some sort of generally accepted terminologies which I will use, and I can clarify if there are any issues as we go forward. So this is like a sort of flag. Now, before we proceed, I think we have to understand that there are two issues here. So there is one issue that is the issue of sex, and the other issue that is the issue of gender. And there is often confusion that these are synonymous. These are actually not synonymous. They are different things, and they are widely separated in what they mean. So when we say sex of a person, it is a biological characteristic. It is how that person's anatomy and physiology is. So it's a biological characteristic, and it is determined by chromosomes and genes. It is determined by the hormones that the body is producing, the kind of gonads that that person has, what is his genitals looking like, outside, inside. So these determine the sex of an individual. All right. So this is a biological characteristic. And classically, from time immemorial, from the beginning of Genesis to a lot of scriptures around the world, it is binary. There is an Adam and an Eve, and there is a male and a female, and the same thing goes on in Manusmriti and various other things. There are two genders classically. So it is a binary phenomenon. And in many societies, especially in Indian and Asian societies, it is one of the fundamental identities. For example, if you say that anybody who says we have a new baby in the house, the first question is not is the baby all right, or is the baby healthy, or is the mother fine. The first question is it a boy or a girl? So it's such a fundamental identity, in at least in our context in India and a lot of Asian cultures, and to an extent elsewhere as well. So it is classically a biological phenomenon. It is determined by biological processes. It is essentially binary as per classical convention, a very fundamental identity. When there is an incongruence between these things, for example, the chromosomes say one thing, but the hormones are saying something else, or the chromosomes are like a girl, but the genitals are like a boy, or the chromosomes are like a boy, but the external genitals are like a girl. So when there is incongruence between the hormones, between the gonads, the genitals, and the chromosome, this is what is called intersex. So there is a problem where there is a biological incongruence between these various components that determine sex. Right? And usually these are associated with anatomical issues, structural problems, and these structural problems, if they are not tackled in time, can be life-limiting and also life-threatening. They can cause death, and they can also cause significant morbidity and interference with normal growth and development in these children. And these are structural, mechanical, anatomical problems. And some children with intersex will require surgery pretty early in their age. So much before, when they are little children, some of these intersex children might need surgical or medical intervention. And this is important because this is happening at an age where they are not able to give consent on their own. They are still young, and usually in medical practice, it is the parent who gives the consent. And here is the big issue. So some of these children, this becomes a major issue as we are managing them as we go forward. So this is about sex, which is a biological characteristic. When we move on to gender, the gender is a psychosocial construct. It is what society has determined about how a particular person has to behave. So it is determined partly by one's psyche. It is determined by the social milieu and norms that we follow and that we live in. So it is a psychosocial construct. It has nothing to do or nothing primarily to do with structure and biology. When we talk of gender, we talk of two things. Gender identity. Does an individual identify themselves as a male or a female? That is called gender identity. Do I consider myself male? Do I consider myself female? The second thing is what is called gender role. That means the society expects a male to perform certain roles in the society. That role might be, he will wear blue dresses, he will play with, trucks and cars, he will climb the trees, and he will, do the kind of things. When he goes out, he will be the earner and he will do all the hard work and the physical work. So that is the gender role that society has decided that males have to play. Similarly, the female gender has to play a role of playing with dolls, wearing frocks, wearing pink colored dresses, playing with dolls, with kitchen sets, they're more, sewing and cooking. And so these are gender roles that society has determined. So when we talk of gender, as I said, it's a psychosocial construct. It is largely dependent by the environment that we stay in, and it is determined by this. So gender identity. So what do I feel is am I a male or a female? Am I attracted to which kind of gender? If I'm a male, am I attracted to a female gender and vice versa? And am I looking after my gender role? Am I doing my role as the society expects me to do? So this is gender, a psychosocial construct. And this evolves and sometimes changes with time. So sometimes somebody, when they are small, thinks that they're a boy. When they grow up, they feel that they are something else. So there are no anatomical incongruencies here. So structurally, generally, things are all right. So this is a psychosocial issue, a psychosocial identity. So I hope it is clear what sex is and what gender is, because this will keep coming up in our discussions as we go forward. Now, there are certain terms that still are attached to gender. So when the person is performing the roles as per his biological sex, for example, I am a male and I am performing my gender roles as a male, then I'm cisgender. That means my biological sex and my psychosocial sex or gender are synchronous. So that is cisgender. Now, when there is incongruence, that means biologically this person is a female, but his gender role is like a male. So there is incongruence, and this incongruence is called gender incongruence. Now, when people have gender incongruence, they themselves feel uncomfortable, or they feel that distress, they feel unease in interacting with the society, because here is this girl who is going to a girls' college, but she is attracted to somebody else who is also another girl. There is gender incongruence, because as per the society, this girl has to actually be attracted to a male. So when you have this kind of thing, that girl is uncomfortable, she has distress, and this is called gender dysphoria. Okay, so these terms are important because they will come up again and again. So sex, which is biological, gender, that is psychosocial, and within gender, these 2 or 3 terms that are important. It is also important to know that several children, or some children with intersex, where there is a biological problem, also manifest with problems of gender dysphoria. So they have a higher incidence of gender dysphoria than what is otherwise in the normal community. So that much for terminology. Now, how do we as physicians look after these children? Okay. So generally, when we talk about these terms, we talk about 2 things. So as I told you, one part of it is where there is a biological problem. Okay, so there is a biological problem and there is an incongruence in biological sex. For example, the child's chromosome is XY, but the external features are like a woman. So there is biological incongruence, and these are patients who we classically classify as DSD, difference in sexual differentiation, or variations in sexual characteristics. These are various terms that are used, and these terms keep changing about depending upon what is thought to be politically correct at that point of time. The other group of patients are what are known as the LGBTQ, which is the lesbian, gay, bisexual, trans, queer, questioning, etc. So these are patients who have gender problems. They usually do not have biological sex problems. So these are patients who have gender problems and they have gender incongruence. So broadly, there is always an overlap, but broadly speaking, one group of people have biological, anatomical, structural problems, and the other ones are basically gender problems. Now, those that have PSD or VSC or structural problems, they often need medical or surgical treatment. And this medical surgical treatment is often required in childhood before the person is competent to give consent. And oftentimes, until now at least, it was always up to the parents to give that consent. This has been changing as time passes. Now, a lot of the transgender people also sometimes require surgery for gender dysphoria, but this usually happens when well into adulthood. And they are perfectly capable of giving consent and making decisions on their own because the need is during adulthood. So we are more concerned about this group where problems happen during childhood, and that is where a lot of the current controversy is resting. Now, until the 2000s, it was a paternalistic way of treatment. All of us have experienced this. We went to a doctor. The doctor told us, look, this is the problem. This needs to be done. Our parents said, all right, do what you want. And the doctor did what he want. And we all generally came out happy. So it was a very paternalistic way of looking at it. So it would be thought that the doctor knew best and you would just follow whatever the doctor said and got it done. But over time, things have changed from this patriarchal approach to how we should look after them. And at that time, until the 2000s, it was thought that it's in the child's best interest that if they are intersex, to make them either a boy or a girl so that they can be mainstreamed in the sense that they can go with their peers, they can go to mainstream schools as there is a boy or a girl. So generally, by the time the patient or the child is ready to go to school, he should be fitting the mold of binary sex. So either he should be male or he should be female sexually or looking at him physically or biologically. So that used to be what the general principle used to be in managing these patients. But over time, it has realized that this is probably not the best way of looking at it. And in the new millennium, especially over the last 20, 25 years, there is unrestricted access to information. So both the families and the children with DSD have access to a huge amount of information. And ultimately, unfortunately, a large amount of this information is of poor quality. It is inappropriate. It's sometimes really disgusting. So a lot of this information that these children and families have access to are very poor quality. And this increases their anxiety, increases their distress, and tendency is to push it under cover even more than what it used to be maybe 20, 30 years ago. There is also a change in society. Over time, the society has increasingly recognized individual autonomy, and this is reflected by the various rights that have been given to LGBTQ community. With in now most places when you have to enter sex, either you have the option of not revealing your sex or of putting other, and even in government documentation this has started to come. So both society, law, as well as governments have started to recognize that there are other things than male and female, and there is also an increasing tendency for individual autonomy. That means I can decide what I need to do with my body. Nobody else tells me what to do with it. Also, as children have been managed over the years, now they are all coming into adulthood. Those that were operated in the 1980s and the 1990s are all now in their 30s and 40s. A lot of them have decisional regret. What was decided them, they are not happy now. Because of that, they do not comply with the treatment that has been recommended. A lot of them continue to have poor quality of life. They continue to have medical psychological issues, social problems of adjustment. So what we were doing before was not ideal is a general consensus. So maybe there are different ways that we have to look at it. So there is a lot of confusion today because the courts are making one set of rules, the government are making one set of rules, and a lot of these rules are actually counter to what our children need. For example, Tamil Nadu High Court was the first one that set the ball rolling, that said that no gender surgery should be performed until the individual can give consent on their own. Unfortunately, as I told you, a lot of the children with intersex will require surgery when there are children. And if you don't operate them on time, potentially it can cause serious risk and it can cause serious long-term consequence in terms of anatomical problems, injury to kidney, injury to their genital structures, etc., etc. So these have become very, very controversial in schools. So all these issues are there that we need to address because all our public spaces are geared to either male or female. So if you have a boy who has to squat while passing urine, he is going to have great difficulty when he goes to a gents toilet, especially in a school, because the children can be quite vicious sometimes. Plus, all our parents and all the parents have their own desires and their own anxieties, and this is something that we need to balance along with or against the autonomy of the child and the ability of the child to ultimately determine what is to happen to him or her as she goes forward, to encourage the child in decision making, and so that we can limit the amount of regret that the child has later, increase their well-being, mental and physical. There are also issues where patients who have been operated in the 80s and 90s are now coming back to sue their doctors and their hospitals. So there are ethical and legal consequences that we should also balance. So ideally today, what should happen? When a child is born, we should be able to look at the child. We should be able to address life-threatening anatomical issues. If the child needs surgery there, that's fine. We have to assign a sex of rearing. We have to assign a sex of rearing at earliest possible in consultation with the parents, knowing fully well that this might be changed later on. However, we should not be doing any irreversible procedure until the child is competent to make their own decisions. This is very important. We have to support the child through adolescence and childhood, and these challenges come. Now, suppose you have a child, a boy who is squatting to pee. What is he going to do when he goes to his school? Does he have a dedicated toilet? Even if you have a dedicated toilet, how are you going to label it? Are you going to label it as intersex toilet? It is going to be discriminatory against the child. So how can we mainstream it? And as a society, are we ready to accept these things? Are some things that we require great amount of education in public, great amount of information spreading out so that people learn what the issues are. Similarly, you might have a girl who is 10, 12, starts to grow facial hair. So how is this child going to manage in her class with her peers? So those told you about how the school issues are, the toilet issues are. They will be harassed at school. They will be harassed at society if they are different. And because of that, they do develop behavioral psychiatric issues. Society is unkind because they are uninformed and they are uninterested. There are a lot of other things that are going on. And by nature, we are discriminatory. We are not easily accepting of people who are different than us. The court and governments have been populist over the last few years. So they make knee-jerk rules just to appease whatever is there, whoever is there in front of them, with not much eye on the ground about what the situation is. And it's usually a one-size-fits-all approach, which I, as we discussed, is not appropriate. From healthcare teams, we are unclear because the regulations keep changing, the expectations keep changing. So there are very few guidelines about how to manage these things. So there are multiple problems. As I said, there is social stigma. How are we going to communicate? So when a baby is born in the family, what are their challenges? There is social stigma. They cannot show because everybody wants to know, is it a boy, is it a girl? You have to take out the nappy and show the patient, show the child. That is not possible. How will you communicate to your extended family and friends? Your uncles and aunties wants to know the sex of your child. Your friends wants to know. How do you communicate with the child when she is growing up? How are you going to tell them what is going on? Can you have access to empathetic care and counseling so that the family is supported, the child is supported? How do you access government documentation? You are not sure whether it is a boy or a girl, or the sex is changed when the child is 12. Now, how do you go to a Tahsildar's office, or how do you change your Aadhaar card from male to female to male, etc.? So all these are day-to-day issues that are very, very important. How do you access public amenities such as toilets? What about schools? In adulthood, can you find a job? Can you find a spouse? And can you attain a reasonable quality of life? Now, Tamil Nadu had set up a rule, and they said, as I told you, I alluded to how it is done. They have a committee that sits in Chennai. So if you have any problem, you send it to them. This is in Madras Medical College. They will tell you whether you can operate or not. They will issue documents that this patient needs to be operated and the sex needs to be changed from female to male. The family takes this document to the Tahsildar's office and they change it. But this is addressing only the medical problem. It is not addressing a whole lot of other things that we alluded to. So how can you, as leaders, in corporate social responsibility, in the corporate world, what can you do? How can you help? A lot of these will be discussed again. So just in broad headings, I think you can participate in education and awareness, as I highlighted, that is probably lacking. Maybe you should help and promote creation of policies and practices within your organizations to help these individuals or help families with these kind of children. Maybe make some arrangements so that they can have equal opportunities in jobs, in terms of the uniforms that you create, provide them healthcare access and advocacy and support. And I'm glad that all of you are here because that is where I think Kaushami is sort of doing the advocacy and the support part of it. And there are a whole lot of things that you can do with your extended suppliers, with education training for employees, with community engagement, etc. As I said, remember, CSR isn't just about financial contribution. It's about creating a positive impact. And by championing intersex rights, companies can contribute to a more equitable and compassionate society. The medical parts, everybody knows what has to be done, but it's a whole lot of other things that need to be fixed. So I'll stop here and thank you very much for your time and for your attention.
Thank you so much, Dr. Rao. Thank you so much. That really, really sets the context beautifully. And also the sensitivity and empathy with which you explained it to us is really, really appreciated. Thank you so much.
Thank you. Thank you.
So to move ahead with this program, post the keynote speech by Dr. Rao, we have a very dynamic panel that has come together today to discuss on this topic. The panel will be moderated by Dr. Jyoti Sharma, who is the additional professor with the Indian Institute of Public Health, Delhi. And her expertise is in public health, working with the government sector extensively and intensively on various programs, various national programs, large-scale programs. And she will help us guide this conversation as we navigate through the complexities of intersectionality. How do we take about empathy-driven initiatives or collaborative approaches to bring about some effective changes and incremental changes? So I would invite Dr. Sharma to take over the stage and to take it away from here. Hi, Dr. Sharma.
Thank you very much, Kashumi, for kind introduction, and thank you very much, Dr. Rao, for setting the stage for this conversation. As I can hear from you that there is a lot of things needs to be done to basically work towards this area where we don't have lot of data available. Researches are sparse. We also have a lot of issues for the acceptance by the society, and also how this medical discourse on the intersex children, where the guidelines are also a lot of confusion is there at that end also. So with this context, I propose to, my pleasure to introduce today's panel. Dr. Shubha AM, she is a pediatric surgeon from St. John Hospital, Bangalore. We also have Ms. Neeraja Sajan. She is a Fulbright fellow on intersex studies in India. We also have a Mr. Rajesh Das, who is a head and group CSR Hindware, which is Somany Impresa Group. Ms. Shilpa, she is a head CSR at JK Cement. Mr. Antony, who is a head at Sterlite Edindia Foundation, and Mr. Arun Arora, who is the director strategies, communication and CSR head of Chetak Foundation, and Ms. Archika Srivastava, she is a head of corporate communications CSR at Hikal Ltd. So welcome to this panel, and to start with, I would like to request Dr. Shubha to help us understand the what is her experience on dealing with the intersex children in the clinic, what are the clinical manifestations, and to, in her understanding, what could be the estimate burden of this variation in India in child population. Over to Dr. Shubha, please.
Yeah, thank you, Dr. Jyoti. That was a very good introduction. At the outset, I would like to thank Kaushmi for having me on board, and it's been a very happy time meeting all of you. Generally, we are in a very medical discourse with the medical fraternity, and this is the first time that I have a varied panelists and varied audience to whom we are going to talk to. As Dr. Rao has already said, that intersex is the biological sex and the incongruence which it brings with respect to the chromosomes, the gonads, the genitals. So that so far, I think we are very sort of we've gotten an idea of the difference between intersex and the rest of the gender dysphorias which we come across. Actually, to go about to say what is the incidence in India, it's very difficult to tell you, because the quoted incidence in literature is up to saying about 0.05 to 2% of the children are born with intersex traits. But in India, I don't think we have a fixed figure as to say, okay, this is what is the incidence, because most of these cases probably are underreported, they go unnoticed, or they're not brought into public awareness at all. So the exact number is still undecided on. Coming to the types or the ways they present, most often the presentation, it could be either in the neonatal period, that is just when the baby is born, or as they have grown to being toddlers, children, and to adolescents. So we would probably, I would like to highlight here that there could be certain medical emergencies in which the child presents to us with. For example, there is a child who's having a very loose watery diarrhea, who is born and is just being breastfed and still tends to lose weight, has diarrhea which is intractable, is going on vomiting, and this needs urgent medical attention. This is not a simple gastroenteritis. Probably it is something much more than that. So I'm just trying to be a little going on to the layman terms, saying that this could be something like a congenital adrenal hypoplasia, that is CAH, which is one of the commonest intersex disorders, and the child is divided or comes under the heading of a salt losing variety. So they present something very similar to an intractable diarrhea, and they get dehydrated. And so it does require an urgent medical care and treatment. So first comes the diagnosis, and then of course the necessary treatment. So there could be children who are a little older who can present with a very simple condition called as a inguinal hernia. So there is a swelling in the groin, and this, which earlier was reducible, becomes irreducible. It gets fixed, and the child is in a lot of pain. And when you probably when the surgeon takes a look and operates, and then you find a gonad in it, which is probably incongruous with what the child is brought with the sex with the child is brought with. These are the urgent medical conditions. Whereas there could be the more commoner variety is a child being born with an ambiguous genitalia. So it is a genitalia, the external appearance of the genitals, which do not fit into what the child is thought to be or rare to be. Either it could be, it, again, the spectrum is varied. So it can just be a very diminutive genitals, which probably is male-like or a female-like, or it could be something which is not fitting into the actual sex of the child. For example, the child is raised as female but does not have the female-looking external genitalia, or there is a child who is reared as a girl but seems to have a very large phallic structure. He has he or she has swellings in the groin which are not congruous with the normal female sex. So these are the various presentations which we come across, and this is what I would say about the incidence in these of intersex in the society.
Thank you very much, ma'am. I think that's really puts me to another important point here, that I think there is a really need to do some kind of research where we can get some estimates of this burden. What is the proportion of children getting, specifically in India, which is we don't have currently data, and that I really would like to emphasize. Thank you very much. I am going to move on to Miss Neeraja. Neeraja, you work with intersex children, and I am sure you are working in quite a lot along with these kind of children. So, what kind of in your experience, what kind of stigma and discrimination these children face in the society? Do you have came across some kind of cases who are who have suffered, and What is your experience in this area?
Thank you, Dr. Sharma. I hope I'm audible. I hope I switched my mic on. Thank you, Dr. Rao, and thank you. Yeah, thank you. Already, Dr. Shubha and Dr. Rao have spoken a lot about what I need to speak about now. So instead of going into what I have seen, I think I will take life course approach of how when the child is in utero, when the child is still a fetus in medical terms or technical terms, and go on from there and give examples so that it's easier for us to see what is happening. Dr. Rao and Dr. Shubha have already told us, but I think the examples might help us really grasp what is happening. Yeah, because all of us here, we are all living in a society that we are socially conditioned to think in binaries, either whether it's about male female sex or man woman gender, and female means woman girl, and male means boy man. That is fixed in our heads. So taking all of this information that we are being given, we have to overcome that to understand. So that's what I'm trying to do here. So one of the examples, the one I want to begin with is a parent I came across in 2017. He was talking about their child's birth. When they were expecting their child and they had gone for the prenatal tests, the doctors had told them that from the tests, it's clear that the child has difference in sex development, which they were called disorders of sex development medically. They were saying your child has a disorder. It's better not to have this child. It's better to medically terminate this pregnancy now, because the child's quality of life in terms of both medical health and social health, it will not be good enough. So it's better that you think about terminating this pregnancy. Now, the parents went through agony trying to, I am not going into the pro-life or against debate here. I'm just bringing out what had happened at that moment. The parents had to go through the entire agony of making a decision about a child they were expecting. And after a long discussion, after a lot of weeks of grueling weeks of decision making, they decided to go ahead and have the child. And when the child was born, turned out the child did not have the variation or any variation that the doctors were worried about. Now, that is not something that the point I'm bringing here is not about it was the doctors or the doctors made a mistake. That's not it. The point about it here is that the idea that the child cannot live in a society like ours because the society cannot, it's not ready for a child like that. What does it speak to? And this is something that intersex community, the queer community, and the disability community is all around the globe is talking about. And that is something something I came across several times during the last 10 years that I have been working with intersex rights in India. The next, I would like to talk about a child who was born, and the child had hypospadias, which means that the urethra is not on the where it is expected to be. That the opening where the urine comes out of, making it clear. And the parents were worried about it. There was more medical complications there, and I was called in because the parents had seen a video by an intersex adult who had put out a video by an intersex adult. And then what happened was the father was worried that this might be an intersex variation and wanted to know what to do. But turned out it wasn't. It was a difference in sex development, but not what would be considered as an intersex variation on a larger note. So they were like, your child is male, do not worry. So the parents did not have support. The parents did not have anyone they could turn to where they could talk about it, ask questions about it. And if they are being forced to take the child home, what kind of care will the child get? What kind of support will the parents get? Those are the things that they were being worried about. We have heard of stories where doctors, out of worried about how the child will be treated in an unprepared family, suggest that they hand over this child to a Hijra community or a trans woman community, because that is a cultural practice that was followed in Southeast Asia. So these things do happen. These things are happening. I would like to move on to educate. Dr. Rao had spoken in detail about schools, about what happens. Our schools, even uniforms are not gender neutral. And if a parent is trying to bring up a child gender neutrally, to give the child the space to understand themselves and be who they want, who they are, how do they do that when you have to give the child's name? Yeah, right. In the schools, if you're trying to, you have to educate the teachers. You have to go to, what do you do? Where do you go to make sure that the child has a safe environment to grow up in? because outside of family, schools are the next stop. And toilets and bullying are main concerns, but not the only ones. What you are learning in classrooms about male bodies, about female bodies, what are they going through when they hear about, learn that, okay, my body does not fall under it. What is going on? Those questions, where do they go to answer those questions? All these come up. All this come under our educational access problems within education, and how do they access social opportunities? What is going on if they don't understand how they are, if their education is telling them that, okay, you are out of place, you don't belong here, they don't have a space to talk about it. For example, I'll give another example here. A child who was born with androgen insensitive syndrome, the doctors will know. It's a type of intersex variation with external presentation of the body, mostly when it's complete, as female. It looks more like the female sex than the male sex, but they will have XY chromosomes, which is male. So since there was already a family member in the family who had a similar variation, when the child was born and the testing was done and found out, the child was informed, okay, you have XY chromosome. But the child did not understand the meaning. The child went to school, and then she learned that XY means male chromosome. And then she went through an entire psychological trauma saying, okay, you told me XY, but I didn't know that meant I'm what? So what does it mean I'm a boy? What does it mean? Because she's considered herself a girl. So that informing the child about the technicality might not be enough, because again, the child is being socialized in our society where we talk about girls and boys all the time. So these are the challenges that I think I have to stop now because I'm running out of time. But these are the challenges that children are facing. And as one more example, and I will stop, this came up when I was talking to one of leading pediatric endocrinologists in Bangalore. And this was again in 2016 or 2015. I'm amazed. I'm really, I have to say this, I am so happy today listening to the doctors here, because it's really wonderful. I have listened to doctors for 10 years now, and I see the vast change, and I'm happy to be here in front of Dr. Rao and Dr. Shubha. I can't express in words. But this particular doctor, who helped me understand that doctors' intention is not to harm. They are really doing what they are being trained to do. They are really looking out for the kids. But the language, the terminology, we get caught up in it. It can cause a lot of trauma, emotional trauma, alienation, and all of that. This doctor was suggesting that a child with a particular variation be reared, go through surgery, go through hormone therapy, and be reared as a girl. But his concerns, the concerns he was presenting, were that the doctor knows the progression of this particular variation. The doctor knows what the anatomical, physiological growth of the child will be like. And the doctor says this child will have limited vertical growth, will have limited height. So if you rear the child as a boy, the child will be only, and he was making a hand gesture. And who's going to marry the kid? Now the parents wanted a son because of the male preference thing in India. So these things also come into play when a child's way of life is being decided by anybody but other than the child. So these things do happen, and they're regularly happening. And I'm glad we are having this conversation here, because hopefully together we can find ways forward. Yes, keeping the children's priority, child as the priority. Thank you.
Thank you very much, and we do agree. I hope all of us agree that child is a priority, and we do care about children. Thank you very much, Neeraja, for bringing out such a pertaining issues related with the social kind of dilemma we face when we are dealing with intersex children, even doctors when they are dealing with intersex children. This is really a critical point. So I am now going to move a little bit ahead with asking Mr. Rajesh Das. So you must be working with child welfare organizations, advocacy group. How is your experience? Excuse me. And how we can actually help in bringing down these harmful stereotypes?
Thank you, ma'am. Actually, we are not working with this child welfare groups right now, but still from a normal point of view, from a social sector point of view, or maybe from a corporate point of view, and from a normal human being point of view, I can say one thing, that we have so many myths, run across all this society, from our childhood, from our schooling days, from our college days, we come across. One of them could be like, related to gender. I think these advocacy groups and child welfare committees and these organizations, those who are supporting gender stereotypes kind of work, they must work under bringing this kind of myth to into reality. And one thing that they should focus on, that everybody is either born as a male or a female. We are not taught that there could be a third gender, or maybe there could be any variance, maybe by nature or something like that. We are not taught accordingly. The second myth, I think, that related to this particular topic, that intersex is a condition that needs to be corrected. I mean, why it has to be corrected, I don't know. I don't understand that. As Dr. Rao was, giving a very wonderful presentation, and he opened so many horizons to understand the fact and the figure. I was just thinking that, just imagine the traumatized situation when the child who is forced to go through all these painful surgeries. Even if we know the intention of the parents are noble, even if we know that the intention of the doctors are noble, but it all this happens because of the society's idea of a person has to be either a boy or a girl. There could be a variance, and we are not ready to accept that. I think the social organizations, child welfare committees, they must wake up and they must take up some kind of initiative to spread this awareness, whether it's a school level or maybe in a college level, or maybe any part of this education system, to understand that whoever is made in whichever way by the nature, we need to accept that. We are not supposed to change that. And if we are changing that, we are trying to change that, just try to understand the mentality of the person who is actually going through all those those situation. Even the Amnesty International condemns all these things. If we are trying to bring any kind of physical or mental change in any human who is under maybe in a teenage, or maybe not in a position to take up a decision. You might be knowing that these kind of decisions of changing physical change, or any operation that is been made, it's been majorly either taken by the doctor or maybe by the parents. The child rarely given any consent, or child is not in a position to take any decision. So who's going to advocate all those things? I think this child welfare committees and all the society, those who are working in this foray, must take forward to do all these things. Simultaneously, I also like to ask all of us to just rephrase what was declared in the Malta Declaration in 2013, when 30 organizations from 30 continents, they approached to various governments, that this normalizing practices, that what we call this so-called normalizing practices, like if somebody has come from a defective kind of piece, we need to do some kind of operations and make it perfectly fine. This is not right, and this should be stopped. So this kind of self-determination, this kind of non-consensual sterilization of intersex people must be stopped. That's what I understand. Thank you.
Hi, Rajesh. I'm sorry, but wasn't able to see you. Can you switch on the camera probably?
Yeah, thank you.
Yeah,
Sorry,
now
I mean,
better.
that's
Thank
a
you.
network issue. Yeah.
No worries, no worries. It's always
Mm.
nicer to see somebody's face.
Mm.
Thank you, thank you.
Thank you very much, Mr. Rajesh, bringing up this important issue about the consent and the rights of the minors, where they are not able to take decisions. So this is really, really important, and I think a lot of thinking and the awareness needs to go in this direction, where we think beyond these. Increase our awareness about not only the sex and the gender, but the dimensions, various dimensions of the gender in our society. my next question to Shilpa Jaiswal. So how these, Shilpa, how these, the corporate initiatives can help increasing awareness among raising and acceptance of these kind of people, the events, which lot of events happens, lot of communication goes from the corporate sector, and how we can actually bring this acceptance of this diversity about gender and about intersexual people in our society. Shilpa.
Yeah, hi, thank you, Jyoti, and hello, everyone. Very good evening. And I think this topic is very new to me. And I can say that I have worked in public health space for very long. And I have worked on LGBT rights, but I was always missing out of it. So being a development professional and being in this profession for so long, this subject is very new to us, right? So understand people who are in corporate, for them how new the subject will be, because when I said, when this topic came to me, the one reason why I have no, so to be very frank, I don't have much of experience about this topic, but I wanted to be part of this panel to understand the topic and create awareness. So when you ask me how the corporates can work around this, I think awareness is the first step towards it. Understanding that the DNI is more beyond gender, it's more about biological. That is something very important. So I think the first step would be to create awareness. Uh, Acceptance is one thing. Accepting, I'm sure many, because once this topic came to me, I started reading about it. There are many organizations who do have employees who are intersex, but they don't come out openly about it. So I think as a space, you have to provide that space where they can come out. They can be pride about they can feel pride about their diversity. That is very important. There are a lot of prejudice and discrimination regarding this community. So I think that is something which needs to be addressed. Acceptance is the first thing. Acceptance, trust me, is very difficult. I have been working into diversity and inclusion of space for very long, and acceptability in that's small things like being a woman in a workspace or being a person with PWD. Acceptance for them is so difficult. So acceptance towards intersex, which is a very new topic for most of the people, it is very difficult. So it's not a very easy journey to do it, but I think we can start with awareness and awareness among the people about this subject. On the other hand, also creating confidence among the intersex children about themselves, making them feel that they can be accepted. I think so I'll give you one example, Jyoti. When this topic came to me, I have a 15-year-old daughter, and I asked her, "Do you know what intersex is?" And she knew it. She knew it and she explained it to me. So I think the younger generation is more aware and more acceptable about it, right? So I think and therefore I have a hope that this generation, the coming generation, will be more acceptable, and that confidence needs to come into the intersex children also, because the acceptability is there. People are inclined, people will be open towards them. So I think that balance needs to be managed. But at corporate level, I think this is a very new topic. This topic is, I have looked through most of the D&I policies of the corporate, but intersex is one term which is missing out of it. It is not there. So I think we have to start with awareness, and this kind of forums need to involve a lot of people from corporate world, people from HR background, people in wherever diversity and inclusion is being discussed, intersex needs to be included into that discussion. So I think that is the way to start it. So and it's a long journey, I can understand that, but never too late to start with. So that's my say on it. But happy to be part of this panel and learn a new thing and add value. So thank you so much.
I'm going to come back again to you, Shilpa. Thank you very much. And it's really, I think you have said rightly that we need to initiate understanding, initiate bringing awareness, and initiate this kind of, so that the intersex people can feel safe when they are working in corporate culture. So going to Mr. Antony, marketing and advertising is the one of the platform which makes lot of noise in our society. So in how these corporate strategies of marketing and advertisement can help us, bringing positive representation of intersex children. Your thoughts will be very, very valuable.
Thank you, Dr. Jyoti, for that question, and thank you for this invitation. Good evening, everyone. In fact, I was smiling when you were asking this question, because we are talking about how this intersex, children, and that concept can come into the marketing, where we are struggling the male-female stereotype in marketing. I mean, there we are still to reach anywhere near equality as far as male-female stereotyping is concerned. So to get a space for intersex is going to be a really a Herculean task. No, I'm not saying it is impossible, but it's going to be a very Herculean task. But at the same time, some of the ways in which we can do is, I'm just reflecting on last time, I think some years earlier, when Tari Samin Per came, that was a time when many of the people came to know what is dyslexia. So I think some of the advocacy group in this, in this sector need to get into, that level of getting into the movies and TV shows where the characterization and the challenges needs to be brought forward. Once they come into the aspect, now dyslexia is not considered as a disability. It's not considered as a disability anymore, at least largely, I would say. There may be in some certain areas still dyslexia as a disability. But people say, yeah, this is something which can be looked at it, and this also can be worked upon. So how do we bring this into the mainstream media? So I wouldn't say it's a marketing point of view, but how do we bring into the mainstream media so that the stereotypes can be looked at? Then bring in increasing the number of diverse and inclusive stories. How do we bring these stories into the forefront? Now, last time, I think in the earlier, Dr. Rao was talking about one example from a couple in Kerala, where they were finding difficult to accept. They had to move out and do the treatment and so on. And in fact, earlier I was discussing with you all, with the other panelists. I think Kerala is one of the states where transgender is very well accepted in the beautician area, and some of them are not only highly paid, but they are highly sought after. Some of them need 1 year advance booking to get their appointment. But however, when the Cochin metro started, same thing did not it did not work out. That acceptance did not work out. So that type of acceptance that can come in the community, the awareness that needs to be generated among the community is going to be much more. So this marketing efforts, the media efforts, the TV shows efforts where the characterization can be brought in might help. And with regard to the corporates, I think there is one of the study that was mentioning LGBT community has approximately $1.4 trillion at their disposal. So not easy for companies to say that inclusion, that concept. Sometimes it may not attract them. The moment they say that there is so much money at their disposal, there's a possibility they may even think about this larger group so that inclusion might come in. That's some of the possibility. Because there's no point in adding one rainbow in the marketing campaign and say, oh, we are inclusive. It's just a kind of a nominal, what I would say, effort. Yeah, it's an effort, good to start with, but that's not going to happen. We need some concrete, real efforts if you want to bring them into and make it an inclusive society. Because as I think Shilpa was talking about, the younger generation accepts much more these these aspects. In fact, for me also, it was not a old topic. It was also a new topic when I came into this particular panel, and I also joined this to see how this can be used for some of my work, where I'm working mainly in the teacher education area. We are working in the pre-service teacher education. We are working with B.Ed colleges and D.Ed colleges in the country. And in general, I have been working in 26 years in the education sector. So as Sterlite Edindia Foundation looking at teacher education, I would like to put in one of the points in the aspect of education. If we have to change the community, we cannot just only work on some of this advertising and marketing. We need to bring in this aspect from education perspective as well. So some of you may say, should we start at school education? When we talk about sex education, we bring in this aspect. Why can't we? Or it's a good thing that we can see that there's already 1 or 2 chapters that talk about sex education at the school level. We need to bring in this aspect of LGBTQI, the I part of it, along with LGBTQ, to be part of the sex education itself. The young people are much more accepting than maybe the elders, as I would say. I would go one more step forward. It's not enough to have it as part of school education or including one chapter in class 8 or class 9 whenever it is being introduced. We need to make this as a kind of curriculum in the teacher education scenario where they are in B.Ed, because we need to change the mindset. Changing the mindset cannot happen overnight. So before the teachers become teachers or get employed in the school, we need to help them to prepare. These are some of the things that needs to be taken care of when you become future teachers in the school. And even some bringing inclusive language in the schools and the colleges. We think about that can be also done in the media. Now, instead of talking about do you have a boyfriend or girlfriend, are you dating anyone? It's a neutral. You're not talking about boyfriend or girlfriend. How do we bring this inclusive language into education, inclusive language into the mainstream media? Then all these things are possible to advocate, because as I was telling initially, we are still struggling to get male female stereotype destroyed. Now at this time we are bringing into other aspect. When we are talking about 30% women, I think reservation is looking at many places. Many of the corporates have got into the diversity element. Many of them have reached that level of 30% or 40% or even 50%. Then you are talking about certain percentage, maybe 5%, differently abled people to be part of it. Now we are talking about 2% or maybe LGBTIQ be part of it. So where do we start from all these things? It has to be a multi-sectoral effort. Marketing is one of them. Mainstream media is one of them. But it has to be a multi-sectoral effort if you have to really make into an inclusive society. Thank you. I think I'll stop there.
Thank you very much, Mr. Antony, bringing up this important issue of inclusivity and education. In education, I think that's the starting point for all of us to start with. And the prominent role of the teachers cannot be denied in this whole initiative of bringing awareness as well as orienting our society towards the next towards a totally different dimension where we actually accept the whole spectrum of different gender identities as well as the LGBTQI people. So moving on to next question is to Mr. Arun Arora. How the corporate sponsored education programs or CSR initiatives can play a role in raising awareness and promoting acceptance. Your thoughts, sir?
Thank you, Dr. Sharma. Thank you, Koshmi Parul, for inviting me to this forum. And a lot of my questions got answered by amazing presentation by Dr. Rao, followed by Dr. Jain's inputs and Neeraja's, Rajesh's, Shilpa's, Antony's. I have a couple of questions that I'm going to ask of this panel. And in addition to that, I would also like to bring something, another perspective to the whole discussion. One is that what is that government of India can do? What is that corporates can do? What is that advertising can do? Before that, can I answer what is that I can do? Can I commit that change from my commitment? Can I start with me? Today, I commit that I'll sensitize at least
10 people on this issue. Number one. Number two, in case all 30 of us commit to sensitize 10 people each, requesting them in turn to sensitize 10 people each. So there'll be a geometrical progression of this message spreading across. So this is a humble submission. Incidentally, I conduct communication workshops for MBA students, medical students, and IS officers, and school students, college students. I promise to add one slide on this aspect also whenever I'm conducting a workshop for them. That is one. Now I have a couple of questions that I just wanted to discuss. One was like we have children with special abilities. I hope this is acceptable term because this term keeps evolving. Uh, okay, now there's special schools for them so that they are not bullied in the main regular schools. So is it a good idea to consider that? Will that protect this intersex students, or will it ostracize them because they're as normal as anyone? So one idea is to mainstream them with the rest of the kids, like we try to do even the special ability children, or do we protect them? Because that can be sorted out once we have conducted this awareness campaign, which involves starting with me, my wife, my children. I'll educate my children, my friends, my society, people in my company. And gradually, if all of us, the entire society becomes sensitive to and becomes accepting of this diversity, this is, everyone is different. All of us are different. I don't have hair and I get laughed at. So that is fine. So, but I'm different, but I'm similarly, everyone is different and everyone has different ability, and and we get born. So that was one point I wanted to bring. Second was my niece is studying prenatal genetics, and I was talking to her yesterday whether we can kind of do some kind of advocacy to enhance some uh, research on this. Maybe India can do it, or maybe we can prompt this medical community to do it, so that this can be not only identified prenatal, this can be rectified prenatal wherever possible, because we cannot have a solution that a kid is conceived, because I understand that only during the 20th to 22nd week of pregnancy only we get to learn whether the genitals are forming properly or not. If it can be done sooner, if it can be corrected prenatal, then we can address this not only for intersex, even for other kind of disabilities that we talk of. That was one. Second is also, again, I take it upon myself and I request all of us whether we can work towards advocating with the power to be the government of India, state governments and policy makers. For instance, we happily have political parties compete with each other to have reservation for scheduled caste, scheduled tribe, and whole lot of other thing. Even for Maratha, there is a 60% reservation. Can we have some reservation in school, in colleges, in higher education, in jobs for special children, including all these categories? Not only intersex, all these categories, can we have some special quota? In fact, I know of certain corporates and certain service organizations who are now hiring specially abled people, and they are proud of it. They run ad campaign to publicize that. Similarly, in case intersex children also fall under that category where they're accepted, and obviously the basics have to be corrected, like Dr. Rao mentioned. Till recently we did not even have an option of deciding. It was plain binary that either you are a male or a female, and the intersex did not even find mention in the official documentation, and it still remains a challenge. So can we all do some kind of advocacy to ensure that government of India has some reservation in education, in jobs, and we have advocacy to spread this message in the society amongst all of us to be more accepting to this set of people. That is one. One more point before I close is, again, I was talking to my niece, and we mentioned, as soon as the child realizes that they have this tendency to be feminine or masculine, so can we educate parents to let it be accepting of that? Because there's this one of the respected colleague also mentioned that in India people tend to have preference for male child, because in case the child is feeling feminine form within, let us rear that child as a female child. So it'll be far more better for that child also. So there'll be a hormonal growth anyway once the child comes into teens. So in case we can align that or educate parents to do that, then I think there'll be a lot less suffering for these children. And one more request, Dr. Sharma, we use the term uh, uh, burden. So can we say quantum instead of burden? So since I'm into communication, I tend to, just listen more carefully. So can we use the word quantum of this, this problem or whatever we want to say? Let's not call it burden. Thank you. So I'll be happy to come again for more discussion.
Thank you very much, Mr. Arun. So when I say burden, it is not a burden in terms of society, but in a very research language, I'm talking the burden of the conditions or burden of the particular issue, which we really, in a public health, that's a common terminology we use. My apologies if
no, not at all.
It's not aligned with you. Moving on to Archika, can you share any of the examples since you work with the CSR initiatives where you have worked with some kind of initiatives and that can be replicated here to provide and improve the support of the benefit of these intersex children. If you can share some of the ideas, that will be helpful.
Sure. So first of all, thank you for having me on the panel. And, I would actually start with resonating a lot with what just Arun said. And most of us in the panel do not have any experience of, how we kind of bring in intersex, because even if you're talking about diversity and, me being in a chemical company, for us, even today, diversity, when we talk about women inclusion, bringing women in leadership. So, we are there. So it's a long journey, as most of the panelists today said. It's a long journey, but of course, we can just start anytime whenever we decide. And that's what brings me to what Arun said, that I would like to actually start with myself. And I totally agree with you, Arun, when you say that, educating 10 people, because when I first joined the pre-discussion, even I learned a lot of things which I did not know about this subject. And I felt like there was this urge of discussing, going back home and discussing with my husband, with my friends. So I think, definitely a very good learning from you today, that when we are talking in some forums, we should include a slide about this and just talk of what we learned and what we could as an individual do. Coming back to your question, Dr. Jyoti, while I will not have any Hikal examples, but I was just thinking, about this question, and I just thought, while there can't be any apple-to-apple comparison when it comes to this particular category, what we are talking here is about inclusive healthcare practices. How we bring in that, or support policies, or maybe some community advocacy programs, and how we kind of address the need of the underserved. So just kind of bringing those aspects, what I feel is that, and I've tried to draw a little comparison with rare disease, because again, the number is very less in that, and there is also a need for specialized care for that segment. There is also a need for creating advocacy for that particular, while it's not a rare disease, but one example which Anthony gave about dyslexia, again, there was a need for people to understand what that disease is. So just trying to bring in some examples in healthcare. So there are a lot of companies in healthcare who are doing, as a part of their CSR initiative, for example, Novartis does this patient assistance program for rare disease patients, so that is one thing which they are doing. So they offer patient assistance programs to provide access to medication for individuals with rare disease who may face financial burden. And these programs also include financial assistance, co-pay support, access to patient advocacy resources. Then there is a company called Shire. They have a rare disease impact report. So we discussed during our discussion today that there is no particular study or a report which actually talks about the number of people and what kind of variation. So there is a whole report which is completely missing for us to understand in India, as you said, disease burden, and I'm going to use the same language because that's the usual language in healthcare that we talk about. So yeah, I mean, maybe there should be an initiative to launch an impact report like how this company did for rare disease. Pfizer has a rare disease research grant, so there could be some companies who could sponsor such researches where these could be taken on board by some healthcare companies. I really like the idea about prenatal test and prenatal. So again, I'm not a healthcare person, so can't really comment on that. But if something like that can happen, if there could be things that could be done to correct that. If there is a way to kind of sponsor something like that, it could be done. Yeah, so those are some examples which I feel that could be relevant and could be replicated for this segment.
Thank you very much, Archika. This is really helpful that we can actually look for some of the existing platforms to seek the support for these children. Then now,
Jyoti ma'am,
yes.
sorry. I think Sanjay sir raised his hand, so I think he wanted to say something. Dr. Rao.
Sure, sir. Yeah.
Yeah, no, I think about this prenatal diagnosis thing. We have a law called the PNDT Act, which is an act that prevents the medical professionals from revealing the sex of the child during antenatal scans. So this is a scan. So it is very difficult to do that today because PNDT Act is an act that comes with penalty of imprisonment. So so there is a problem there. So that is something that we will have to discuss. So it's not, yeah, and not all of them can be diagnosed. Only a small minority can be diagnosed prenatally. But even when you have that, you cannot reveal this to the family.
Understood.
Thank you, Dr. Rao. And Dr. Shubha also, I think.
May I come
yes,
in?
Mr. Arora. Yes, Mr.
A couple of points. Thank you, Dr. Rao. In fact, if doctors can check the sex or gender of the baby, and they're not supposed to reveal it to the parents, that is agreed because that is what Indian laws say. But if the doctors discover there's some abnormality, maybe I think we should do advocacy to amend that law so that at least those kids are taken care of. That is number one. Number two, I also understand that insurance companies do not offer insurance or extend insurance to such children. So I think maybe we can do another advocacy wherein if parents are insured by default, even kids should also get insured. And whole lot of foreign insurance companies are now eyeing huge Indian market. This is the least they can do to at least insure these children also.
Thank you, sir. Thank you. Thank you. Dr. Shubha, you wanted to say something. I think Dr. Shubha has also raised her hand.
Ma'am, please unmute yourself.
Shubha, ma'am, you're on mute.
Sorry about that. Am I audible now?
Yes.
Yeah, this was regarding Mr. Arun's comments. One was what Sir said about the PCPNDT Act, and that's an act which has come in because of the female feticide, which has been quite rampant in India. And I think there's a lot of thinking gone on to bringing this act as a rule. So the intersex children, I mean, I'm going to go take a step back and then reiterate what Sir had presented, saying that we are still looking at, I don't know if all of you got the fact that we are looking at intersex and LGBT as two different different faces. We are not combining both of them because the pathology, I wouldn't say the pathology, but the variations in these two communities are different, and the way they have to be looked at is different, and their management probably is also going to be different. That is one aspect of it. And second one is that many of these, as Sir said, are not all of them are diagnosed prenatally. Most of these are chromosomal studies, probably, which will pick up. One of them is the adrenal hyperplasia, the hormonal study, which can be picked up. And that is more so to prevent the fatality which would come without when noted, and then these children are not handled properly. So that is more for that rather than saying take precautionary actions maybe before your with your prenatal diagnosis. So that is a point which I wanted to make. And then regards to the bit of segregation, I would think about if you said that if you had a different school, like a school for um, less abled. So it is not, I don't think that these children would fit into this category because these children are probably with a very good psych. And they are all normal children. I mean, if you let them be in a group of children, they are all normal children. They want to be like that. And they are, in fact, like that. So it is just about the anatomical problems which they have, which need to be probably to some extent corrected so that they don't have a dysphoria when they are in a group. So if you sort of segregate them, probably we would do more harm than good
Yeah.
to these children. So I think that is what I wanted to highlight about.
Thank you, Shubha
Thank-
ma'am. Jyoti ma'am,
Yes.
sorry, I just wanted to remind you about the time.
Yeah.
So maybe we could take one question from the participant, which I've tagged you in, if you could take that.
Yes.
And we could then probably close.
Yes. So I think the question is, since 1.7% of Indian population could have intersex children, the challenge lies in educating them, their parents, and support ecosystem. How do we plan to do this? Obviously, this would also need substantial funds to support all related activities. What about support from government agencies in coming up inclusive policies? So I think a lot of the discussion has to be that how do we go forward? That's the whole request I am looking at through this question is. To me, I think the request is that how CSR initiatives can support this kind of initiatives to take some of the research projects, look generating some solid evidence, also coming up not only with data on the what is the problem, but also what works in the field. How the best examples to support these children. I think it's really important for us to have these understanding about that. What are the good example, positive example, what works in the field, so that people get encouraged to and the work further in this field, and we can help more of the children. There is a lot of efforts need to go on, not only for the uh, increasing awareness on the about those who are the parents of intersex children, but also the future generation, future parents who are going to be parents. So I think it's a whole spectrum of the efforts, whole ecosystem which this question is talking about. So any thoughts from anyone? Most welcome. Dr. Shubha? Ma'am, you are muted, sorry.
Sorry again. Yeah, we did do a sort of educational awareness creating sort of, I wouldn't say policy, but a few guidelines, which would probably help those people to be aware that there is a child who is born with intersex. So we looked at making up posters and then showing them which are the medical emergencies, which are the surgical emergencies, and these probably had to be dissipated to the grassroots level workers, like say in ANMs. So this is from the medical perspective, but there could be, as per the educational awareness, so that could be partly maybe propagated by probably small groups, or even have these peer groups of these particular children who could be themselves helping out in creating awareness. That is in the medical field, I would assume. And probably all the corporates and the NGOs would support such initiatives to be taken to the societal level, because we are looking at this problem as not just an individual problem, a child's problem, but it is a very huge social problem. And there is a lot of hindrance from the society, from the families, and they go through a lot of issues when they have to relocate, when they have to change their certificates, and when they have to, relook at the whole scenario and come back to lead a sort of normal life in another society which probably did not belong to them. So I think these are the things which we have to take care of when we are looking at this, and that would be by a collective effort rather than just be it a medical field or be it an NGO or be it a government policy or be it a CSR initiative. I think that's what I want to say.
Thank you very much.
Can I come in, Dr. Sharma? I'm sorry, I
Mr.
keep butting in.
Arora, Mr.
Yeah.
Arora, just 1 second. Rajesh, I think you have a hard line right now. Would you want to give us your closing statement and then we can continue? And you,
Okay.
if you want to leave, then you can probably.
Yeah. See, we discussed so many things. I mean, frankly speaking, many of us who are the panel members were not, from this kind of background. We are practitioners who are, promoting corporate social responsibility into various domains and various aspects. Schedule 7 of the Companies Act, Section 135, Clause 3 promotes gender diversity and gender equality and all. I believe that every company, those who are actually, promoting gender sensitivity and gender diversity, must take all these things into consideration while we are talking about DEI and we are talking about this, LGBTQ plus and all. I think I aspect has to be, an integral part of all this. When Antony was talking about this, policies, these educations and this, curriculum and all, I believe that specialized curriculum can be developed at the school level, and to support that, CSR funds and CSR initiatives can be, created in a manner that the board has to be sensitized, and the board has to be very, sensitized in such a way that specific funds dedicated to this particular cause can be, utilized. That is point number one. Point number two, I also like to, highlight that when Archika was saying that Novartis and some other companies, those who are into healthcare, domain, they give some kind of assistance to, to the patients, those who are not able to afford. So I think, healthcare companies can take care of all this consideration under their CSR domain. This has to be a random practice, and this will not come into existence unless and until similar kind of awareness and sensitizations will not come into existence. Third thing, while Mr. Arun was talking about this insurance companies. See, insurance companies, I don't know whether they will be implementing all these things into their policies or not. I mean, how much time it will take unless and until I believe there is a policy level change done by the government of India. I don't think any change will come under this. But having said that, even insurance companies, they cannot, or may they do not, they are not able to do it right now as per their policies, insurance policies, but under their CSR, they can implement this kind of activities where, where specialized surgeries are required or anything related to medical attentions are required. These companies can support and go beyond whatever policies included or not. Third thing I just wanted to share, and that is the final one, that so we are a company who is into bath and sanitation business, and we are also promoting this gender related work where, by creating toilets at the schools, we promote girls toilet facilities, behavioral change campaigns, menstrual hygiene, and all these activities that we're doing at the schools. I believe that similar companies, like including my company also, those who are into similar kind of business, they can create, they can support under the CSR, under the specific kind of restrooms or maybe specific kind of awareness sessions. Wherever we are doing this kind of initiatives, we can include it in our CSR activities. Those NGOs who are specialized into all this kind of activity, they may reach out to this kind of companies. Not every company is going to, act and do gender sensitivity activity, but those companies, those who are, doing similar kind of work, or maybe any particular activity that has been done and that has that this intersex kind of activity can be clubbed into that. This similar kind of project can be developed, and I believe a lot of things can be done in a policy level, in an advocacy level, as well as in implementation level. That's all I wanted to tell you. Thank you.
Thank you very much, Mr. Rajesh. This is really valuable comments and thank you very much for bringing up this, because we really do need the support from through the funds. Without finances, it's really difficult to carry out anything. So different ways of taking funds is really, really important. Moving on to Archika, would you like to add? You are muted.
Yeah, sorry. So, whatever Rajesh just said just got me thinking, and, I'm just thinking in my head some practical challenges, and that brings me to the point that, Arun was trying to make. And that's just the way I think, and it could be right, wrong, and maybe not in way everybody else who is part of this, initiative thing. But I do agree to a certain extent that we need a special school, because let's say as a CSR professional, I want to construct these special toilets, or I want to cater to their needs in a certain way. I go to a school, in a village, and I say, okay, I want to construct these toilets for you. There won't be any acceptance, because I don't know how many number of these kids would be there. So I'm trying to solve a problem which I don't even know whether it exists. If there are special schools, I know, let's say, even if there are 10 students of the same one, is that they become a support group to each other. They support each other because they're similar kind. And you can also do a lot of initiatives for them, so that for us CSR professionals also it becomes easy. Otherwise, all we can do is educational programs and just talk to people in general. But we also have to understand a normal human being. While of course most of us are CSR professional and we feel that this subject should be talked about, but most of the people outside do not care about this. And if you go tell 10 people, out of them 5 people will be like, okay, let's talk about the weather or something else. Maybe they're not interested, right? I'm just talking a very practical thing. So one has to think from a very practical perspective also to solve these problems, and not just the emotional side, which of course is important. Empathy in action, I love the topic, and it is the empathy which is the starting point. But how do we address in a practical way is also important, which obviously starts with me. What can I do? And then what can we all together do is important. That's my submission.
Thank you very much. Thank you. Yes, Rajesh.
Just one thing I just wanted to add you while Archika was saying, yes, I agree that just building toilets and just building, infrastructure facility won't solve the problems. See, just one small case study. Just wanted to add you that last year, I just received a proposal from an NGO, which was, creating hostel facility for those who are born out of sex workers in JB Road. So it was a very typical kind of project, and the NGO was not that much reluctant. I mean, that much adamant, but the approach was like, if we support, obviously it will meet some kind of CSR compliance, but simultaneously it will add on to a specific cause that is beyond our reach, beyond our policies. So I believe that while we don't have the statistics, obviously we don't know how many similar kind of intersex children are there in the school or not. We don't know that. So constructing toilets won't make any sense. But yes, if we know that there is an organization who is supporting similar kind of cause, there are hundreds, maybe thousands, or some number of students over there. Yes, any support can be done over there. A particular location, a particular budget, a particular strategy, that is acceptable. Point number one. Point number two is that if that organization, XYZ organization, having said that, that initiative is being taken by the organization and it is only dedicated to this intersex children, beyond sanitation, if any education support is required, maybe some kind of scholarship, some kind of fellowship required, I think that also can be crafted within the proposal. And NGOs must be very, very careful while pitching up this kind of thing, right? If they don't have the numbers, they don't have the particular kind of issues to address upon specific clause that has been mentioned under section 7. So crafting and accepting the proposal is also at times difficult for the corporates. So I think it's a both kind of scenario. We are not here to put a tick mark under the CSR. Even the NGOs must understand that if you are pitching up a project, it has to be strategically aligned with the cause as well as the gender sensitivity. That's what I ended.
Thank you very much. I think this is also a very important point you have raised about how do we, approach to the problems when we are looking at the funding from some CSR or any other organization. Thank you very much for your inputs. Anyone would like to add before we close this session?
Yeah, I just like to add one more point. Sorry, I don't. Please go ahead.
No, Anthony, please go ahead. I can.
Yeah, Mr. Anthony. Yeah,
right.
Please.
Yeah, Anthony, and then probably Shilpa, because I think she also needs to leave.
Okay.
Yes, Anthony, go ahead.
I'll just be quick. In fact, no, I also heard about Archika talking about healthcare companies that needs to be, giving some certain grants. They can really, push this particular cause into the limelight. But I think this type of webinars is just a drop in the ocean of efforts that all of us can make it. More and more such conversation needs to get in various conferences, not just health sector, but in general, any cross sector that we have. But the second part, which I would like to say, I think Dr. Shubha was talking about LGBTQ and this intersex children. Of course, definitely, it's a kind of a different scenarios. But however, even it's like when we want to open our hands in terms of if it's like this, it's very easy to close one by one. But the moment we make it to a fist and we ask them to open it up, it's very difficult. So what I would say, at least in the start, to be for a good start, how do we partner with excluded groups so that together the voice will be heard much better and faster. However, we need to get into a mass awareness. We are already very late in bringing this one into the mainstream information. So mass awareness through the point that earlier I was trying to stress rather. How do we get them into the mainstream movies? Can we get some of the leading actors to be part of these discussions? In fact, many people see them more than any of the so-called good doctors who can speak about it. That's how this materialistic world go for it. And even looking at the infrastructure, there are many companies working in the infrastructure area. Can we also advocate with them to develop inclusive infrastructure? Of course, there's for male toilets, female toilet. In some areas, there is also other, they have kept it. But how do we put a kind of a gender neutral male, female, so that the major chunk goes there? But do we have a kind of a infrastructure which is more inclusive is something which can be looked at it. Then maybe can we advocate with some of the corporates? Many of the corporates are looking at 2% of their profit for CSR, or maybe even many companies also go beyond that. Maybe certain percentage of that can be received for some of this type of community. And last point from my side is how do we advocate spreading awareness through the education system that is there? Then I think this particular inclusive environment will be more beneficial for all of us to live in. Thank you.
Thank you very much. I will now invite Shilpa. I think she has to leave early.
She has left actually, Jyoti ma'am.
Okay.
So we can probably ask for closing comment if anybody else wants to give.
Yeah, Mr. Arun, go ahead, please.
Yeah, thank you, Dr. Sharma. Amazing suggestions, Antony and Archika and Rajesh. Just one thought occurred to me, and I'm sure this must be happening. Dr. Rao would know better. Can we get these parents of intersex children together to have a support group, some community wherein they can support each other? I'm sure there must be some. If they're not, maybe we can facilitate that. So in case parents of such children can come together and then they can advocate and we can also support them. That is one. Second point I wanted to make was, we can either focus on whatever cannot be done or whatever challenges we will face, or we can focus on how it can be done and how do we facilitate these things to happen in the real life situation. So let's make efforts towards that direction. All of us can even write blogs, or we can tweet our thoughts, or we can use social media. We can keep writing there. Make small efforts so that we enhance the awareness, and then and let's also uh, parallelly start doing advocacy to Government of India, like in the insurance example. For instance, we can do advocacy with Government of India to force IRDA to make it mandatory for insurance companies to offer insurance to insured parents, children of insured parents, irrespective of whether they're healthy or not. They cannot be just eating cream away from healthy patients. No, that is the basic concept of insurance. If they choose not to insure unhealthy newly born child, then that is unfair. They are just creaming the Indian market. Just a thought. Just a thought. Thank you.
Yes, Dr. Rao.
Yeah, I think the insurance not covering congenital malformations has been a grouse that because we are pediatric surgeons and our primary patient population are children with congenital anomalies. It's been hell. IRDA has actually issued notifications to insurance companies that they cannot refuse, but still it continues. Fortunately, a lot of the government-sponsored insurance schemes that are there now, including Ayushman Bharat, do cover a fair amount of these. And I think it has become an important enough issue from an election perspective that governments are now pushing state governments are trying to set up their own insurance plans, and a lot of these congenital anomalies are getting covered. But the commercial insurance players are still putting up a big fight. So that's about the insurance part of it. I agree with you entirely. I think the strongest voices have to come from families of children affected. Unfortunately, this is a very sensitive subject. People don't like to talk about it. And finding brave enough families to come forward, or young adults who are intersex patients or who intersex people to come forward with their own voices as advocates for this group would probably be the most effective tool. Because if we start advocacy, they will say that, look, they are trying to ensure that they have enough practice and they can make money. So there is always ways to spin it, and I think the strongest case can be made by families. And as it has happened, for example, the rare diseases, the big push has come from families with children who have had rare metabolic diseases, and they have been people who have been pushing the governments. In fact, Karnataka government has allocated some 20-30 crores as money for subsidizing rare diseases. So, so I think from this Intersex Foundation and things, I think it's a good start, because that's where it is starting from. And I think if more of these affected people come on board, I think the impact is going to be far more.
Well said. I think thalassemia patient is a typical case wherein parents come together, they pool in blood, and they do a whole lot of things, and they save those people. Yeah, thank you.
There is exceedingly large amount of funding now for thalassemia for bone marrow transplant.
Correct.
Absolutely. All India has got huge funds.
Correct. Thank you.
Yeah. Any more comments from anyone?
Paushami has raised her hand.
Yeah. I just wanted to say that there is Colonel Parmar over here. They have actually founded this organization called Ayush Pay. And very generously, Colonel Parmar has offered to tie up with us as a healthcare partner to support these children, whether in terms of getting the medical care that they need or the diagnostics that they need. Of course, it has to be worked out. The entire scenario has to be worked out on how we need to go about it. But thank you very much, Colonel Parmar, for suggesting that. Colonel Parmar, do you want to say anything?
Yeah, I think my heartiest compliments to everybody. This is a wonderful initiative. We've operated in smaller towns, and villages of India. And we are very happy to support you people. We have team which can take care of a lot of, psychological aspects which are associated with this kind of problem which our children face. So I think we should tap, the financial wherewithal from some of the industrial partners who can join us in this initiative. The rest of the things we can take care of definitely with your kind support. I think all of us can join hands together and really benefit, children. Obviously, the first step is to create the kind of awareness. I was very happy to hear some of the children who are already aware. I had to actually Google it, so it's really surprising. I'm from the healthcare industry. I've been CEO of few chains of hospitals and handled some big healthcare establishments. But I did not hear this term earlier. And I comes towards the end in LGBTQI. So I think, disproportionately lower attention. But I believe this group actually needs much bigger support. And, the resources are absolutely limited, and even the support from the government, because I was trying to see what kind of policies are there, what kind of financial wherewithal is being allocated. The government recently opened 186,000 wellness centers, right? We are PHC, CSC. There is absolutely no infrastructure which is existing for the LGBTQI. Recently, we approved a healthcare budget of almost 90,000 crores. Okay, 86,000 to the healthcare and 3,000 crore to the research and innovation. Absolutely zero for LGBTQI, who so desperately needs funding. So, in the absence of that, I think the industrial partners, as part of their CSR initiatives, can divert part of their resources for this kind of a very, very noble cause, which will help, millions of children who might be suffering from not just this kind of a challenge, but also the mental issues, emotional issues associated with it. Not just with the children, the parents are also impacted. See, our attention is not even on the parents who have these children who have to continuously take care of them. So the challenge is bigger, resources are limited. I think we need to participate and make sure that this wonderful initiative from ICFI, madam, from you and everybody else on this panel, show their level of interest in pushing the advocacy further. So my heartiest compliments to everyone. We will be a very small part of this initiative, very happily able to contribute in whatever small manner we can make a difference. And I'd love to hear from you all in what manner you'd like to have our support in looking after these wonderful children.
Thank you so much. Thank you so much, Karan.
Thank
Jyoti
you
ma'am,
so
over
much.
to you.
Thank you very much for your participation today in this interesting conversation. In fact, for me also, this is a first platform where I am actually talking about intersex children. Of course, from the public health perspective, this remains a undiscussed problem. We don't. In child health already, we do have a lot of challenges going on in terms of public health. So this remains a very, very very less discussed ish topic for the public health, larger public health umbrella, if I say. Thank you so much for inviting me here as a moderator, Kaushumi and the Intersex Children Foundation. Thank you very much for all panel members for your inputs. This is a great learning experience, a new start for us. Let's work together to make some difference, starting from our own and then bring it to the larger society. Thank you very much. Over to Kaushumi.
Very well moderated, Dr. Sharma, very well moderated.
Thank you very much, sir.
Thank you to everybody. And as I was telling Parul on the sidelines, that I had tears in my eyes, and Neeraja would understand this, because Neeraja has been working in this for this cause for the last 10 years. I have been working on this for the last 5 years. And the task of reaching from there to where we are today, where we have such empathetic people with us like you today on this program, it's a huge happiness matter of happiness for us, because it's taken a lot for us to reach this position where people are so enthusiastic, so encouraging, and so supportive, of our cause, for our children, because ultimately it's the children who are the priority. All of us are just a means to that end. So thank you very much.
Koshmi, when Neeraja was speaking, I was reminded of that on a humorous note. When Neeraja was speaking, I was reminded of that Hindi film dialogue, Pagli Rulaigi Kya? Seriously. she was so passionate, it really touched our hearts. Yeah.
And if you leave it to Neeraja and me, we will never stop talking on this subject. So better we shut up fast. But thank you everybody. Thank you everybody for your, kind participation here. Thank you to all the participants who have joined this. I have just posted a link, a survey link in the chat box. If you could please provide us your valuable feedback. It's always our endeavor to improve ourselves. Your suggestions, insights would also help us. So I know we've taken a lot longer from you than we had expected, but the conversation was so engaging, I didn't want to put a stop to it. But thank you very much. And thank you, Parul, and your team for making this happen, for making this possible.
Thanks a lot. Thank you, Kashu.
Thank you, everybody. Thank you. Have a great evening. Have a great week ahead.
Thank you, everyone. Such a pleasure.
Bye-bye. Thank you, everybody.